Your liver is quietly working right now, performing over 500 vital functions to keep you alive. But what if I told you that this incredible organ could be failing, and you might not even know it? In fact, up to 25% of adults are walking around with some form of liver damage, often without a single obvious symptom, until it's almost too late. Today, we're uncovering the 10 warning signs your liver is in trouble. Signs that are so subtle, most people ignore them until irreversible damage has already occurred. Here's the incredible news: your liver is the only organ in your body that can regenerate itself. Even if up to 75% of it is damaged, it can grow back, but only if you catch the warning signs early enough. The problem is, your liver doesn't have pain receptors, so by the time you feel something is wrong, the damage may already be severe. What causes liver trouble? Well, it could be excessive alcohol consumption, fatty foods, medications, viral infections like hepatitis, or even autoimmune conditions. But here's what matters most. Your body is trying to warn you right now through unusual signs that have nothing to do with pain. Stay with me until the very end, because I'm going to reveal not just the warning signs, but the most powerful science-backed remedies that can help your liver heal and regenerate, starting today. Let's dive in. If you're waking up exhausted, even after a full night's sleep, and you feel drained throughout the day despite drinking coffee or resting, your liver might be sending you a distress signal. This isn't just regular tiredness. This is a deep, unshakable exhaustion that affects your ability to function normally. Here's why this happens. Your liver is responsible for converting nutrients from food into energy your body can actually use. It processes carbohydrates, stores glucose as glycogen, and releases it when your body needs fuel. When your liver becomes damaged or overworked, this energy production system breaks down. As a result, your body struggles to maintain normal energy levels, leaving you feeling perpetually drained. But there's more to it. A failing liver also struggles to filter toxins from your bloodstream effectively. When toxins like ammonia begin to accumulate, they affect your brain function, causing something called hepatic encephalopathy in severe cases. Even in mild liver dysfunction, this toxic buildup can make you feel mentally foggy, confused, and utterly exhausted. Interestingly, researchers have discovered that people with non-alcoholic fatty liver disease, which affects nearly 1 in 4 adults worldwide, report chronic fatigue as one of their earliest and most persistent symptoms. If you've been blaming your tiredness on stress, poor sleep, or aging, but nothing seems to help, it's time to consider your liver health. This is especially urgent if your fatigue is accompanied by any of the other signs we'll discuss today. Imagine feeling an intense, maddening itch all over your body, especially on your palms and the soles of your feet. But when you look at your skin, there's absolutely nothing there. No rash, no bumps, no visible irritation. This bizarre symptom is actually one of the more specific warning signs of liver dysfunction, and it can be absolutely torturous for those who experience it. This condition is called pruritus, and it happens because your liver is failing to properly process bile, a digestive fluid that helps break down fats. Bile is produced by your liver and stored in your gallbladder, but when your liver is damaged, bile acids can leak back into your bloodstream instead of being properly excreted. These bile salts then accumulate under your skin, triggering nerve endings that create that relentless itching sensation. What makes this particularly frustrating is that typical anti-itch creams, moisturizers, and antihistamines usually don't provide any relief because the problem isn't on your skin surface, it's happening from the inside out. The itching tends to be worse at night, can disrupt your sleep, and may become so severe that people scratch until they bleed, desperately seeking relief. This symptom is particularly common in conditions like primary biliary cholangitis, an autoimmune disease that slowly destroys the bile ducts in your liver, and in cases of bile duct obstruction from gallstones or tumors. Studies show that up to 80% of people with cholestatic liver disease, where bile flow is blocked, experience this intense itching. If you're dealing with unexplained itching that won't go away, especially if it's accompanied by yellowing of your skin or eyes, dark urine, or pale stools, you need to see a doctor immediately. This is not something to ignore, as it indicates your liver's bile processing system is seriously compromised. Have you noticed your belly getting larger even though you haven't gained weight? Or perhaps your ankles and feet are swelling up by the end of the day, leaving deep indentations when you press on them. This isn't just water retention from eating too much salt. This could be a critical sign that your liver is failing. When your liver becomes severely damaged, it can no longer produce adequate amounts of a protein called albumin, which is crucial for keeping fluid inside your blood vessels. Without enough albumin, fluid begins to leak out of your bloodstream and accumulate in your tissues and body cavities. When this fluid collects in your abdomen, it's called ascites, and when it pools in your legs and ankles, it's called peripheral edema. But that's not the only mechanism at play. A damaged liver also causes increased pressure in the portal vein, the major blood vessel that carries blood from your intestines to your liver. This condition, called portal hypertension, forces fluid out of your blood vessels and into your abdominal cavity, causing your belly to swell dramatically, sometimes making you look pregnant even if you're not. Here's what's particularly concerning. Ascites is often a sign of advanced liver disease or cirrhosis, where healthy liver tissue has been replaced by scar tissue. If you're experiencing significant abdominal swelling, you might also notice difficulty breathing because the fluid is pushing up against your diaphragm, difficulty eating because your stomach is compressed, and rapid weight gain from the fluid accumulation. Medical research indicates that once ascites develops, the 5-year survival rate for liver disease patients drops significantly, which is why this symptom should never be ignored. If you notice unexplained swelling in your abdomen that doesn't go away, or if your legs are swelling and the indentation remains when you press on them, you need immediate medical evaluation. Your doctor can perform an ultrasound or CT scan to assess fluid accumulation and determine the extent of liver damage. The good news? If caught early enough, and with proper treatment, the liver can recover, the swelling can resolve, and you can prevent progression to complete liver failure. But time is absolutely critical. Have you noticed that you're bruising much more easily than you used to? Maybe you bump into something lightly and end up with a large, dark bruise. Or perhaps you've noticed that small cuts take much longer to stop bleeding than they should. You might even experience frequent nosebleeds or notice blood in your gums when you brush your teeth. These aren't just signs of fragile skin or clumsiness. They're red flags that your liver isn't producing the clotting factors your blood needs. Your liver manufactures most of the proteins responsible for blood clotting, including factors like prothrombin, fibrinogen, and factors 7, 9, and 10. When your liver becomes damaged, its ability to synthesize these essential clotting factors dramatically decreases. As a result, your blood loses its ability to clot effectively, making you prone to excessive bruising and prolonged bleeding from even minor injuries. Here's the science behind it. When you injure yourself, your body initiates a complex cascade of reactions that involve these clotting factors working together to form a stable blood clot that stops the bleeding. But if your liver isn't producing enough of these factors, this cascade gets interrupted and the clotting process fails or takes much longer than normal. Interestingly, doctors often use blood tests that measure clotting time, like the PT-INR test, which stands for prothrombin time and international normalized ratio, to assess liver function. An elevated INR indicates that your blood is taking longer to clot than it should, which is a direct marker of reduced liver synthetic function. What's particularly alarming about this symptom is that it indicates your liver damage has progressed beyond just inflammation. It means your liver is losing its functional capacity to produce essential proteins. If you're experiencing easy bruising along with other symptoms like fatigue, abdominal swelling, or jaundice, you need comprehensive liver testing immediately. This combination of symptoms could indicate cirrhosis or even acute liver failure, both of which require urgent medical intervention. This might sound strange, but the color of what comes out of your body can tell you a tremendous amount about what's happening inside your liver. If you've noticed your urine turning dark brown or amber-colored, similar to the color of tea or cola, while your stools have become unusually pale clay-colored or even chalky white, Your liver is desperately trying to tell you something. Here's the physiological explanation. Your liver produces bile, which is a greenish-yellow fluid essential for digesting fats and absorbing fat-soluble vitamins. Bile contains a substance called bilirubin, which is a yellow pigment created when your liver breaks down old red blood cells. Normally, bilirubin flows from your liver through bile ducts into your intestines, where it gives your stool its characteristic brown color and eventually gets filtered by your kidneys into your urine in much smaller amounts. But when your liver is damaged, inflamed, or when your bile ducts become blocked, this normal flow gets disrupted. Bilirubin can't reach your intestines properly, so your stools lose their brown color and become pale. Meanwhile, the excess bilirubin backs up into your bloodstream, gets filtered by your kidneys in much higher concentrations, and makes your urine turn dark. This combination of dark urine and pale stools is particularly concerning because it indicates obstructive jaundice or cholestasis, conditions where bile flow is severely impaired. This can happen with gallstones blocking your bile duct, pancreatic cancer pressing on the duct, primary biliary cholangitis, or severe liver inflammation from hepatitis or cirrhosis. What many people don't realize is that this isn't just a cosmetic issue. When bile can't flow properly, your body loses its ability to properly digest fats and absorb crucial vitamins like A, D, E, and K. This can lead to malnutrition, vitamin deficiencies, and further health complications. The fat-soluble vitamin K deficiency, in particular, worsens the bleeding problems we discussed earlier. Medical studies show that when both dark urine and pale stools appear together, especially if accompanied by yellowing of the skin and eyes, it requires immediate medical investigation with blood tests, ultrasound, and possibly more advanced imaging. This is not something you should wait to see if it gets better on its own. Early intervention can prevent permanent liver damage and identify potentially life-threatening conditions like bile duct cancer or acute hepatitis. This is perhaps the most recognizable sign of liver trouble, when your skin and the whites of your eyes take on a yellow or slightly orange tint, a condition called jaundice. But what many people don't realize is that by the time jaundice becomes visible, your liver function has already been significantly compromised, which is why catching the earlier signs we've discussed is so critical. Jaundice happens when bilirubin, that yellow pigment we talked about earlier, builds up to abnormally high levels in your bloodstream. Remember, bilirubin is normally processed by your liver and excreted through bile. But when your liver is damaged, it loses its ability to process and eliminate bilirubin effectively, causing it to accumulate in your blood and deposit into your tissues, giving your skin and eyes that distinctive yellow color. There are actually 3 main types of jaundice, and understanding which type you have helps doctors determine what's wrong with your liver. Prehepatic jaundice occurs when too many red blood cells are being broken down, overwhelming your liver's processing capacity. Hepatic jaundice happens when the liver cells themselves are damaged and can't process bilirubin. This is common in hepatitis, cirrhosis, and alcoholic liver disease. Post-hepatic jaundice occurs when bile ducts are blocked, preventing bilirubin from leaving the liver. This happens with gallstones or pancreatic tumors. What's particularly important to understand is that jaundice severity correlates with the extent of liver damage. Mild jaundice might just cause a slight yellowish tinge that's most noticeable in the whites of your eyes, while severe jaundice can turn your entire body a deep yellow or even greenish color. Researchers have found that when bilirubin levels rise above 3 milligrams per deciliter, which is about twice the normal level, jaundice becomes visible. At this point, you're also likely experiencing other symptoms like dark urine, pale stools, intense itching, and possibly confusion or mental changes if bilirubin levels are extremely high. Here's something crucial. Newborn jaundice is relatively common and usually harmless, but jaundice in adults is always a medical emergency that requires immediate evaluation. It could indicate acute hepatitis, cirrhosis, liver cancer, bile duct obstruction, or even conditions like Gilbert's syndrome or hemolytic anemia. The underlying cause must be identified quickly because some of these conditions can progress rapidly to complete liver failure if left untreated. If you notice any yellowing of your skin or eyes, don't wait for it to get worse. Seek medical attention immediately. Blood tests, imaging studies, and sometimes liver biopsy can determine the cause and guide treatment to prevent further liver damage. While your liver itself doesn't have pain receptors, which is why liver disease often progresses silently, the capsule that surrounds your liver does have nerve endings. When your liver becomes inflamed, enlarged, or when conditions like liver abscesses or tumors develop, this stretches the liver capsule and can cause a dull, aching pain or tenderness in your upper right abdomen, just below your rib cage. This pain is often described as a deep, uncomfortable sensation that may worsen when you press on the area, take a deep breath, or lie on your right side. Some people describe it as a feeling of fullness or heaviness in that region, while others experience sharp stabbing pains that can radiate to their right shoulder or back. Here's what's happening inside. When your liver becomes inflamed due to hepatitis, fatty liver disease, or alcohol-related liver injury, the organ swells and presses against the surrounding capsule and nearby structures. This inflammation is your body's immune response trying to fight off infection or repair damage, but the swelling causes that characteristic pain and tenderness. By eliminating alcohol and toxic exposures, adopting a liver-healing diet, rich in antioxidants and anti-inflammatory foods, supporting your liver with targeted supplements, exercising regularly, optimizing your sleep and managing stress, and losing excess weight gradually if needed, you can dramatically transform your liver health. These aren't just theoretical recommendations. These are interventions backed by solid scientific research showing real improvements in liver fat, inflammation, enzyme levels, and even reversal of fibrosis. But you have to start now. Liver disease is often silent until it reaches advanced stages, so even if you're only experiencing 1 or 2 mild symptoms, take them seriously. Get comprehensive liver testing done, work with your healthcare provider to identify the underlying cause, and implement these healing strategies immediately. Your liver has been working for you since before you were born, and it will continue working until your last breath. Leave a comment below telling me which warning sign surprised you most, or share your own liver health journey. Your story might inspire someone else to take action. Remember, your health is your most valuable asset, and it's never too late to start taking better care of your liver. Thank you for watching, stay healthy, and I'll see you in the next video.